Hi, this is Rech, physical therapist at Rech Physio. Today I'm talking about golfer's elbow, or pain that's on the inside of your forearm. So if you're having pain on the inside of your forearm, there's a couple things you want to differentiate. First is the exact location, because that's going to make a little bit of a difference of what you might do with it. So if it's in the muscle belly, where like the bulk of your muscle, if that's where you're feeling sore or the pain, it might be that you have a muscle strain. And so if it's a muscle strain, the way you would treat that is kind of backing off a little bit of whatever you're doing that's kind of aggravating it to a point that your muscle can tolerate. You know, some gentle exercise with the wrist, with the arm, and kind of progress as your muscle allows. So you kind of need to back off a little bit for a period of time. But if the pain or the discomfort is more in the tendon, so your forearm muscles connect to your medial epicondyle here, which is just this bump or this bone on the inside of your elbow. And so if the pain is more kind of in the tendon area, and so if you kind of push right where that bone is, or down from it, and that's where you're feeling the pain, so it's probably more in the tendon then. So what you're going to do for that is a little bit different. The two main ways that you treat tendinopathy or pain in the tendon is with isometric and eccentric exercises. So what that would look like for the wrist or for the forearm is kind of a curl type exercise, but you're not going to go do the up and down kind of normal curl type exercise. That's probably going to actually aggravate it a little bit. Isometrics are where, so you can use your other hand to kind of pull up and then you just hold. And so that's called an isometric, where your muscle is working, but the length is not getting shorter or longer. You're just holding it in the same position. And what you want to do is shoot for about 240 seconds that you hold that. The 240 seconds doesn't have to be all at the same time. You could do like reps of 20 seconds. And so if you did 20-second reps, that'd be about 12 times, or a set of 12. Or you could do whatever you kind of feel like there. What you're trying to do is get time under tension for the tendon, and that just allows the force to be going through that tendon. And what this tendon needs to do is kind of restructure and reorganize to allow it to tolerate that force. And so that's isometrics. Eccentrics is where your muscle is lengthening as it's working. So what you want to do then is you make it shorter, and you can lift it up so that it doesn't have to do the work of shortening, because that's probably what's going to be irritating for it. And then you slowly lower so it's lengthening as it's working, and then you can do reps of that. So you assist it up with the shortening phase, and then as it's lengthening, which is lowering your wrist in this case, that's the eccentric phase. And so you're just going to go just do reps of that. You can do a set of 10 or 12, and you might need to work your way up from one to two to three sets with that. And that, with the isometrics or the eccentrics, you can kind of do either one. Like I said, the main overarching theme with that is just time under tension. It's getting force, a tolerable amount of force through that tendon, and allows it to kind of reorganize and restructure, and that helps with the pain. So you might need to do that for a few weeks, kind of back off of whatever is irritating it the most, and do some of these exercises. And so you want the weight to be relatively heavy, so that way you kind of have to have the other hand assist, and then you're slowly lowering it for the eccentrics. And for the isometrics, just again, it's something that's relatively heavy, that is a tolerable amount of weight that's not irritating it, but still is putting force through that tendon and still working the muscle. For kind of a quick fix, folks will use a Chopart strap, which is just like a cloth or neoprene strap that you wrap around the forearm here. And what that does, it just kind of compresses and changes the direction of the force through the tendon a little bit, and can help with the pain. Like I said, that's going to be a quick fix, kind of a Band-Aid type treatment. It's not going to get at the root of the problem, which is kind of the structure of the tendon, and the tendon not being able to tolerate the load that you're putting through it. So you really need to do the isometrics or the eccentrics to get at the root of the problem. But the strap can be a quick fix that can give you some short-term relief as well. So give those a try if that's a problem for you, and hope it helps.